These are 16 signs that your blood sugar is running high. And the 8 symptoms, the Centers for Disease Control and Prevention lists as the standard warning signs of diabetes. Every figure, threshold, and explanation you are about to hear comes from published material from the CDC, the World Health Organization, the American Diabetes Association, and the Internationals Federation. And each one carries the year it was reported, so you know how current it is. One thing needs saying before we begin. This is educational information and not medical advice. And if any of what follows sounds familiar, the answer is a conversation with a healthcare provider rather than a self-diagnosis. Now, what is actually happening inside the body when blood sugar climbs? Glucose comes mostly from the carbohydrates in your food, and insulin, the hormone your pancreas produces, is the key that lets that glucose move out of your bloodstream and into your cells where it becomes energy. Diabetes takes hold when the pancreas stops making enough insulin, or when the body loses the ability to use the insulin it has. Either way, the result looks the same from the inside, with glucose piling up in the blood while the cells that need it sit starved. Hyperglycemia is the medical term for that buildup. Here is the part that catches most people off guard. Symptoms usually stay quiet until blood sugar has already climbed above roughly 180 to 200 milligrams per deciliter, according to Mayo Clinic. And Cleveland Clinic notes that plenty of people feel nothing at all until they reach 250 or higher. The number 180 matters for a second reason, because that is roughly the point at which your kidneys can no longer hold on to all the glucose passing through them. And once they start spilling it into your urine, a whole chain of symptoms begins. That chain is where the list starts. Sign 1 is frequent urination. Once blood glucose pushes past that kidney threshold, the sugar your kidneys cannot reabsorb ends up in the urine filtrate, and sugar pulls water along with it through simple osmosis. Doctors call this osmotic diuresis, and it means more urine, more often, with the nighttime trips being the ones people usually notice first. Sign 2 is thirst that never seems to switch off. All that lost fluid leaves the body dehydrated, so the brain does the obvious thing and demands replacement. What makes this pairing so recognizable is that it feeds itself, because the more you drink, the more you lose, and the cycle keeps turning as long as glucose stays high. Sign 3 is hunger that eating does not fix. Without insulin doing its job, glucose cannot get into the cells, so those cells send out the signal that they are running on empty. The strange result is a person who is hungry, while their bloodstream is flooded with fuel they cannot reach. These first 3 carry a name in medicine, the 3 Ps, standing for polyuria, polydipsia, and polyphagia. Sign 4 is weight loss nobody planned for. When glucose is off limits, the body turns to fat and muscle for fuel instead. And, on top of that, every gram of sugar lost in urine is calories walking out the door. This tends to arrive faster and hit harder in type 1 diabetes. Sign 5 is fatigue. Cells deprived of their main energy source do not perform, and dehydration stacks on top of that, which is why the tiredness described by people with high blood sugar tends to be the heavy kind that sleep does not resolve. Sign 6 is blurred vision. High glucose shifts the fluid balance inside the eye, and the lens itself swells and changes shape, which throws off its ability to focus. The reassuring part is that this usually reverses once glucose comes back down. The less reassuring part is that years of exposure damages the small blood vessels in the retina, and that damage does not reverse. Sign 7 is cuts and sores that will not close. Chronically, high glucose narrows blood vessels and slows circulation, so oxygen and nutrients arrive at the wound in short supply, and immune function drops at the same time. Feet are where this shows up most often and where it matters most. Sign 8 is catching infections more often than you used to. A weakened immune response is half the story, and the other half is that bacteria and fungi treat excess glucose as a food source. Sign 9 follows directly from that. Yeast infections and urinary tract infections climb because sugar in the urine and on mucous membranes feeds Candida yeast. Women tend to notice this pattern earlier and more frequently. Sign 10 is numbness, or tingling in the hands and feet. Prolonged high glucose damages the peripheral nerves, a condition called diabetic neuropathy, and it announces itself as tingling, burning, numbness, or pain. Roughly half of people with diabetes develop some form of nerve damage over time. Sign 11 you can actually see in a mirror. Dark, velvety patches of skin appear in the body's folds, at the back of the neck, in the armpits, around the groin, and the medical name is acanthosis nigricans. Excess insulin, which is what insulin resistance produces, stimulates skin cells to grow through IGF-1 receptors, and the thickened pigmented patches are the visible result. What makes this one worth knowing is that it often shows up before a diagnosis exists, marking insulin resistance while it is still in the prediabetes stage. A 1992 study by Hud and colleagues found it in 74% of an obese study population. One caveat belongs here, because in people with darker skin tones, these patches can appear without insulin resistance behind them, which makes the sign a stronger predictor in lighter skin. Sign 12 is skin that turns dry and itchy. Fluid loss leaves the body dehydrated. Circulation drops, and nerve damage adds its own contribution, and the skin dries out as a result of all three. Sign 13 is headaches, tied to that same dehydration and to the swings in blood sugar affecting the brain. Sign 14 is irritability and shifting moods. High glucose interferes with brain function, and the fatigue underneath makes everything worse. And endocrinologists point out that mood tends to lift once glucose comes under control, which tells you the chemistry was driving it. Sign 15 shows up at the dentist. Bleeding gums and periodontal disease become more common because weakened immunity leaves the gums and the bone anchoring the teeth open to infection, while high sugar encourages bacterial growth. Left alone, it progresses toward loose teeth and pockets of pus. Sign 16 is the one that should send someone to an emergency room. Breath that smells sweet or fruity, sometimes described as smelling like nail polish remover, points to diabetic ketoacidosis. With no insulin available, the body burns fat for fuel and produces ketones, one of which is acetone. And acetone is exactly the chemical in nail polish remover. You exhale it, and that is the smell. Ketoacidosis is a medical emergency, and it belongs mainly, though not exclusively, to type 1 diabetes. Physical stress and illness can trigger it in type 2 as well. 3 more signs did not make the count of 16 and still deserve a mention. Nausea, vomiting, and abdominal pain travel with very high blood sugar and with ketoacidosis, and they get mistaken for stomach flu, often enough to be dangerous. Sexual dysfunction develops as high glucose damages the nerves and blood vessels supplying the genitals, showing up as erectile dysfunction in men and as low arousal and vaginal dryness in women. Dizziness rounds out the group, driven by the same dehydration that leaves less water available to the brain. The 16 signs describe high blood sugar broadly. The CDC maintains a shorter, more specific list, published on its Symptoms of Diabetes page and last reviewed on the 15th of May, 2024, covering the symptoms shared by both type 1 and type 2. Number 1, frequent urination. Number 2, increased thirst. Number 3, increased hunger. Number 4, losing weight without trying. Number 5, fatigue. Number 6, feeling irritable or moody. Number 7. Blurry vision. Number 8. Frequent urinary tract infections or yeast infections. The CDC adds a few items that point more toward type 2 specifically, listing wounds that heal very slowly, dark patches of skin on the neck, armpits, and groin, and numbness or tingling in the hands or feet. For type 1 and ketoacidosis, the agency flags nausea, vomiting, and stomach pain. One detail from the same source is worth carrying with you if you have children, because unexplained bedwetting or a sudden increase in accidents can be a sign of type 1 diabetes. Scale explains why this list matters. In the United States, according to the CDC's National Diabetes Statistics Report, updated on the 21st of January 2026, using 2023 data, 40.1 million Americans have diabetes. That works out to 12% of the population, or roughly 1 in 8 people. Of that group, 29.1 million carry a diagnosis and 11 million do not, which means 27.6% of American adults with diabetes have no idea they have it. The prediabetes figure is larger still. 115.2 million American adults have blood glucose above normal but below the diabetes threshold, and 31.3 million of those are aged 65 and older, which represents 52.1% of American seniors. Around 1.5 million Americans receive a new diagnosis every year. Globally, the picture scales up. The International Diabetes Federation, in the 11th edition of its Diabetes Atlas published in 2025 with estimates for 2024, counts 589 million adults between 20 and 79 living with diabetes, which is 11.1% of that population, or 1 in 9 people. 252 million of them, roughly 43%, remain undiagnosed. The Federation projects 853 million by 2050, 3.4 million deaths. That is what diabetes caused worldwide in 2024, according to the same source, working out to roughly 1 death every 9 seconds, and accounting for 9.3% of all global deaths. Health spending on diabetes reached $1.015 trillion in 2024, a 338% increase across 17 years. Type 2 accounts for more than 90% of all cases, and 81% of people living with diabetes are in low and middle-income countries. The trend line running underneath those numbers comes from the World Health Organization's 2016 Global Report on Diabetes, which recorded adults with diabetes quadrupling from 108 million in 1980 to 422 million in 2014. Inside the United States, diabetes was the underlying cause of roughly 95,190 deaths in 2023, and it appeared on 399,342 death certificates as either an underlying or a contributing cause that same year. The gap between those two figures tells its own story, because diabetes is nearly 3 times more likely to contribute to a death than to be recorded as its cause. It ranked 7th among leading causes of death in the United States in 2023, having ranked 8th in 2021 and 2022. The CDC also identifies it as the leading cause of kidney failure, of non-traumatic lower limb amputations, and of blindness in adults. Fasting plasma glucose, measured after at least 8 hours without calories, reads as normal between 70 and 99 milligrams per deciliter. Between 100 and 125 puts a person in prediabetes, described more precisely as impaired fasting glucose. At 126 and above, that is diabetes. Hemoglobin A1C works differently, reflecting average blood glucose across the previous 2 to 3 months. Below 5.7% is normal. 5.7 to 6.4% is prediabetes, and 6.5% or higher is diabetes. The oral glucose tolerance test measures where blood sugar sits 2 hours after a 75-gram glucose drink. Under 140 is normal. 140 to 199 is impaired glucose tolerance, and 200 or above is diabetes. A random glucose reading of 200 or higher points to diabetes when classic symptoms accompany it. Beyond that single situation, a diagnosis requires 2 abnormal results, either 2 different tests or the same test repeated. On screening, the association now recommends that testing for type 2 begin at age 35, earlier for anyone overweight with additional risk factors, repeating every 3 years when results come back normal. Older material still circulating puts that age at 45, and 35 is the current figure. Hearing loss belongs in this conversation more than most people realize. According to the CDC, hearing loss occurs twice as often in people with diabetes as in people of the same age without it. And even people with prediabetes carry a 30% higher rate. That page was reviewed in December of 2023 and draws on an analysis of national survey data covering 1999 through 2004. Depression is the second one. The CDC reports that people with diabetes are 2 to 3 times more likely to experience depression, and that only 25 to 50% of those who develop it are ever diagnosed and treated. The third involves timing, and it explains everything about why this list of signs exists. Research published in Diabetes Care in 1992 by Harris and colleagues concluded that type 2 diabetes begins at least 4 to 7 years before anyone diagnoses it, with the same authors suggesting the real gap may run 9 to 12 years. The disease works quietly for years while the damage accumulates. Gestational diabetes carries its own long shadow, because roughly half of women who develop it during pregnancy go on to develop type 2 diabetes later. According to the National Institute of Diabetes and Digestive and Kidney Diseases, none of this is new. People have been describing these same signs for thousands of years. The Ebers Papyrus, written in Egypt around 1550 BC, describes a condition of excessive urination that matches what we now call diabetes. In 6th century BC India, the physician Sushruta named it Madhumeha, meaning honey urine, and physicians there diagnosed it by watching whether ants gathered around a patient's urine. The word diabetes itself is Greek, meaning to siphon or to pass through, a description of the urination. Mellitus is Latin for honey sweet, added by the English physician Thomas Willis in 1675. And Willis reached that conclusion the way his contemporaries did, by tasting urine. 17th century England had a blunter name for the disease, calling it the pissing evil. Matthew Dobson confirmed and measured the sugar in 1776. Everything changed in a Toronto laboratory. Frederick Banting, working with the medical student Charles Best alongside the physiologist John MacLeod and the biochemist James Collip, isolated the first pancreatic extract on the 27th of July, 1921, announcing the discovery that November. On the 11th of January, 1922, a 14-year-old named Leonard Thompson received the first insulin ever given to a human being, and after a refined dose on the 23rd, his condition improved dramatically. The Nobel Prize followed in 1923, and Banting shared his prize money with Best, while MacLeod shared his with Collip. The diagnostic goalposts have moved since. The fasting glucose threshold dropped from 140 to 126 in 1997, and A1C joined the diagnostic criteria in 2009. Not everyone accepts that prediabetes should be treated as a diagnosis. Dr. John Yudkin, writing in the BMJ, calculated that the association's criteria would classify more than half of China's population as prediabetic. Dr. Victor Montori of the Mayo Clinic has pointed out that only about 5% of people with an A1C between 5.7 and 5.8% progress to type 2 within 5 years. Ronnie Marks, writing in the Annals of Family Medicine in 2024, argued the label is overdiagnosed and can do more harm than good for low-risk patients. The counter-argument from the association and the CDC is that the label buys time, and their estimate is that 15 to 30% of people with prediabetes develop type 2 within 5 years. Ann Albright, who directed the CDC's Division of Diabetes Translation, framed the intent this way when the agency launched its awareness campaign. Her words were that the major message is to use this as a warning, not to frighten people. GLP-1 medications have reshaped both treatment and public awareness. Semaglutide, sold as Ozempic, Wegovy, and Rybelsus, received FDA approval for type 2 diabetes in 2017, for obesity in 2021, and for cardiovascular risk reduction in 2024. These drugs prompt the body to release more insulin when blood sugar rises and reduce hunger at the same time. A fair health analysis published in May of 2025 found that more than 2% of American adults took a GLP-1 for weight loss in 2024. And among people with type 2 diabetes, roughly 1 in 5 held an active prescription. The most recent word on the undiagnosed problem arrived in September of 2025, when a study in the Lancet Diabetes and Endocrinology from the Institute for Health Metrics and Evaluation estimated that about 44% of people aged 15 and older living with diabetes worldwide do not know it, and projected 1.3 billion cases by 2050. Lauren Stafford, the study's first author, put the stakes plainly, saying that if nearly half of the 1.3 billion people expected to be living with diabetes by 2050 do not know they have a serious and potentially deadly condition, it could easily become a silent epidemic. Dr. Rita Kalyani, professor of medicine at Johns Hopkins University, described the pattern this way in September of 2025. Symptoms include increased thirst or hunger, frequent urination, blurry vision, unexpected weight loss, and fatigue. But in the early stages, most people with diabetes have no symptoms at all, which is what makes screening and diagnosis matter. 16 signs and 8 symptoms on the official list. What connects them is that not one requires a laboratory to notice, because they show up in bathroom habits, in a mirror at a dentist's chair, in the way a small cut refuses to close. They also share a limitation, and it is the reason the closing point matters more than the list itself. Signs appear late. Type 2 diabetes runs for at least 4 to 7 years before diagnosis, and 11 million Americans, along with 252 million people worldwide, are living with it right now, without knowing. Waiting for a symptom is waiting for damage that has already been accumulating. Blood tests find it earlier. Screening from age 35. Sooner with risk factors. Every 3 years, when the results come back clean. Anyone recognizing several of these signs in themselves has a reason to book that appointment now, rather than later. Dr. Margaret Chan, then Director General of the World Health Organization, wrote in the 2016 Global Report on Diabetes that halting the rise in diabetes requires rethinking daily life, eating healthily, being physically active, and avoiding excessive weight gain. This has been educational information and not medical advice. Any of these signs deserves a conversation with a qualified healthcare provider.